Hi, hello, assalamualaikum. Today I would like to present about the anti-helminth drug. It's a mebendazole. Let's go through one by one. Okay, first is introduction. Anti-helminth are drugs that either kill, vermicide, or expel vermifuge infesting helminth. Helminthiasis is prevalent globally of the population herpes, and helminthiasis is more common in developing countries with poor personal and environmental hygiene. In the human body, especially GIT, is the abdomen of many helminths, but some also live in tissue or their larvae migrate into tissue. They harm the host by depriving him of food, causing blood loss, injury to organs, intestinal or lymphatic obstruction, and by secreting toxin. And also, helminthiasis is a rarely fatal but is a major cause of ill health. Okay. This one is an effect of helminth, induced immunity on infection with microbial pathogen. This one is a tissue damage, go through the induced the release of cytokine alarmin, interleukin 33, interleukin 35, and TSLP, and also promote the production of cytokine, eosinophil, and basophil, and become to CD4 cell, and excrete the secondary molecule produced and worm can shut down disease synthesis of pro-inflammatory cytokine and promote DC production of the immunoregulatory molecules, and also affect the bone marrow precursor and increase T cell, Th2 effector cell, regulatory Th1 cell, decrease Th1 and Th17 effector cell. Okay, next, this one is tissue helminth. Okay, this one is our abdomen. Okay, this one, the right one is filariasis, diagnosed by parasite in the night blood, serology. Treatment is ivermectin, diethylcarbamazine. This one, hydatid disease, diagnosis with liver ultrasound or CT, and serology. Treatment with albendazole, ivermectin. And third is the left one is onchocerciasis, diagnosis by parasite in skin snips, serology, examination of eye. And this one is treatment is ivermectin. And also is schistosomiasis is diagnosed by parasite egg in feces or urine. Serology treatment is parisoquintal. Okay, next is this one is to show you the children with the STH. STH is soil transmitted helminth infection. The major STH infection which include ascariasis, theocariasis, and hormone infection are among the most prevalent infection in developing countries because STH worm burden are higher in school age children than in any other single group. Okay, this one is antihelminth drug. Okay, classification is based on chemical structure. This one is piperazine, diethylcarbamazine citrate, DEC, piperazine citrate. Two is benzimidazole, albendazole, mebendazole, and thiabendazole. Third is heterochylics, oxaminitin, and pyrazinamide. Four is natural product, ivermectin, ivermectin. Five is vinipyrimidine, parental or xanthal. Six is amide, nicosamide. Seven is nitro derivative, nerirazole. And lastly, imidazole, levonisole. And this one is a antihelminth drug. Okay, you can see. Okay, this one is the drug of antihelminth is mebendazole in our drugstore. This one is a green one is for children. This one is for adult. Mebendazole is a synthetic bemidazole that has a wide spectrum of antihelminth activity and a low incidence of adverse effect. It's a drug of choice in the treatment of infection by whipworm egg, hookworm, and roundworm. Mechanism of action is a mebendazole probably act by inhibiting microtubule synthesis, is bind with a parasite B tubulin, and inhibit its polymerization. In addition, mebendazole probably block glucose uptake in parasite and deplete its glycogen stores. Efficacy of the drug varies with gastrointestinal transit time, with intensity of infection, and perhaps with the strength of parasite. And this one is pharmacokinetic. Absorption of mebendazole from intestine is minimal. Less than 10% of orally administered mebendazole is absorbed. The absorbed drug is a protein bound. Less than 90% rapidly converted to inactive metabolite rapidly during its pass in the liver and has a half-life of 2 until 6 hours. 75 until 90% of oral dose pass in the feces. The dose is 100 mg chewable tablet, 100 mg per 5 minutes suspension, 100 mg tablet. Membranous is one of the preferred drug for treatment of multiple infestation and is more effective than mebendazole in tuberculosis. This one is adverse effect, well tolerated even by patient in poor health. Mild nausea, vomiting, diarrhea, and abnormal pain have been reported infrequently. Rare side effect is usually with high dose therapy hypersensitivity reaction, rash, urticaria, agranulocytosis, alopecia, and elevation of liver enzyme. Mebendazole is teratogenic in animal and therefore contraindicated in pregnancy. It should be used with caution in children younger than 2 years of age because of limited experience and rare report of conversion in this age group. This one our reference, and that's all. Thank you so much for your attending that presentation. Thank you. Bye.